So before I start, can everyone see the slide title and the people? Okay, awesome. So yeah, this is my presentation on sloppy science and its impact on the COVID-19 pandemic. Basically, we're going to be talking about two problems in science. One of them is scientism, which is this idea, this belief and feeling that only science matters. And what we have is science, and we should only be focusing on that. And if anything is labeled as science, it's true, it's right, and it's the way to go. And then the other problem is sloppy science, which is this carelessness and lack of rigor in the research process, as well as the reading process and digestion process from the audience looking at the science. And what happens when these two come together? Well, basically we have errors in policy and decision-making. So now I'm going to try and illustrate this concept with some public health examples. The first one is hydroxychloroquine. So I'm just making my video go away. Can everyone still see the slides? All right, great. So hydroxychloroquine, what happened was this one paper came out that was small scale, and it was conclusive in and of itself, but it lacked rigor. And basically what it says is that hydroxychloroquine could be this cure for COVID-19. And what happened is people that read it, the media, they said, oh my gosh, this is it. This is what the pandemic's gonna be over because of this. And that got blown way out of proportion. People started talking about it. But what people weren't talking about was the study's small sample size and other issues in the study. Now, these issues are okay, but they have to be talked about and they have to be explained. And also there was another study that wasn't okay, and it did actually have issues, and people used that as evidence because they didn't read the entire study. But what happened was this miracle cure resonated with everyone, and people only looked at what they wanted to see. And yes, moving on now to masks. Oh, no. Sorry, my slides are not shifting. Okay, great. So healthcare workers used masks from the start. Early communication was against wearing them, though. So already from the beginning of the pandemic, we have this difference in what we're seeing versus what we should be doing. We're not understanding what we should be doing. So then when we were told to wear masks, we were kind of unsure as to why we're supposed to be wearing them. We weren't told about aerosols. We weren't talking about concentration or ventilation. We just said, okay, go wear masks. So there's this lack of understanding in the public because of bad communication to the public. And what about homemade masks? Why were these ignored? Why were these other options that could have potentially saved lives and prevented cases? Why weren't they discussed? Why was it so concrete? An explanation, a full explanation from the CDC could have probably prevented many transmissions. Third example, surface transmission. So a fomite is any object that can transmit a virus to a person. So if I cough on my laptop and then someone uses my laptop, if I'm sick and there's germs in that cough spray, they didn't touch the laptop, get the germs on their hands, touch their face, and they might get sick. In this case, the laptop is the fomite. So in the beginning of the pandemic, we had this obsession with fomites. It was almost unnecessary. We didn't fully understand if fomites were the reason people were getting sick. There was this misguided focus on what the real dangers of COVID transmission were, which it's through the air. That wasn't really being talked about. There was this obsession of cleaning groceries and letting packages sit out for a few days to disinfect, and sanitizing and washing hands, which is great, but that wasn't what was preventing transmission. So this lack of explanation was actually quite dangerous, because people were in rooms with many other people not wearing a mask because they didn't understand. Well, they were washing their hands and sanitizing and whatnot. That's misguided. So an example in the media was when the New York Times did an article on this, and they wrote about a Buddhist temple where a bunch of people got sick. And what happened was they said, okay, there are all these COVID-19 particles on all these touch surfaces like handles and light switches. This must be how people got sick. And then they published this article, yet that's not how these people got sick. We know now, looking back, they got sick through the air. So vitamin D is my final example. A study was done recently that said that people with vitamin D in their body have a better chance of having better COVID-19 health outcomes. And what some people are now saying in the media and just in the public is that well, if we supplement with vitamin D, then we can prevent COVID or we can have better health outcomes. Well, correlation does not equal causation. And just because some people in one area that this study was done on have higher levels of vitamin D than other people doesn't mean that they're going to have better or worse COVID health outcomes. It's a great study. It's promising for promoting further research, but it doesn't translate to great policy decisions yet. We need to do more research. We need to have more rigor, which brings me to my summary of the general mistakes people can make. Shortcuts when reading. We need to read all of the study to understand its full limitations. We need to avoid applying scientism and understand that science might reveal things we don't want to know. We also need to discuss the study with its limitations. Leaving them out is sloppy science. And we also need to give context to all results, positive, negative, whatever we find, we need to talk about it within the full context of the study. So to summarize, what we need is an increase in academic rigor. We need the awareness that science isn't perfect, and we need better communication on these two things. Thank you.
Thank you for that talk, Brendan. I'm now going to welcome.
Yeah, thanks. This is actually a joint question for both Sophia and Brendan. I think they're great presentations, all of them. And I think it's really good, especially that Sophia's and Brendan's were just after Professor Goldenberg's talk, just because there was so much relevance there. So kind of maybe like building on all three of those, I was just wondering, Sophia, it looks like in your analysis, you were kind of highlighting three separate groups who are interacting. So obviously the government, and then the public, and then the scientists themselves. And then Brendan, you also seem to do that, and you also added the media. And so just like as a fourth group, I guess. I'm not sure if you can obviously push back against that. This is kind of a broad question. But turning back to Professor Goldenberg's idea that the interactions and the trust and such should go both ways, I'm just wondering, and you can answer this like however broadly, narrowly you like, what you think like the ideal or what pitfalls you've seen so far in your analysis of the COVID situation of this maybe three-way or four-way interaction and how it goes both ways. So not just like the government oppressing, like misinterpreting science and the public, you know, what all of the things you talked about. So maybe Sophia, if you could, because you highlighted those three groups pretty explicitly. That's really helpful, thank you. And then yeah, Brendan, if you could talk maybe on the media aspect of that too, that'd be great.
Great, thank you. So I've observed that any group can participate in sloppy science however much they want or don't want to, or whether they know it or not. It doesn't matter how much credibility someone or some group has, they're all so fallible just as much as someone who doesn't understand that they're being fallible. It goes both ways, and it could be anywhere along the spectrum of 1%, even 0%, all the way up to the just like spouting things that seem right but are really just not right, all the way up to 100% sloppy science, you could say. And I think the same thing can happen with scientism. Anyone, no matter how much credibility they have or how much credibility they don't have, can participate in scientism, which is kind of scary. But I think that's why it happens so much and it happens so broadly, is because anyone can do it, no matter, I think I'm repeating myself, but no matter how much experience you've had, how much research you've read, how much you know or don't know, it can happen to anybody.
Thanks, that's really helpful. Thank you.
Thank you for that final question, Nikki, and for all the great answers and discussion from our presenters and participants. Now I'm going to hand it back to Nikki for brief 1-minute closing remarks.